Of the spokesperson. Hi, good morning. Let me say pleasant morning to members of the media, to those friends who are listening in. Today, the opposition, the People's National Party, will be hosting a press conference to deal with some of the topical issues that are afflicting the nation at this point in time. You will hear from the leader of the opposition, MP Mark Golding. He will be followed by the spokesperson on finance, MP Julian Robinson. Dr. Morris Guy, the spokesperson on health, is joining us virtually. He will speak next on the COVID reality. After that, you will hear from MP and spokesperson for energy, MP Paulwell, and then Michael Phillips will take us on a journey as he speaks on transportation at the end. So at this time, please make welcome the leader of the opposition, Mr. Mark Golding.
Thank you, General Secretary Dr. Dayton Campbell. Members of the media, thank you for joining us. Thank you, colleagues, for being here. Jamaica has been enduring the worst disaster of our lifetime. The COVID-19 pandemic has taken over 1,300 lives in Jamaica, and the daily rate of deaths in August is higher than ever before. Our hospitals are overwhelmed, and our doctors, nurses, and other frontline healthcare providers are exhausted and frustrated. This unprecedented crisis needs a genuinely national response. The National Disaster Risk Management Act is the legal framework for disaster management in Jamaica. It establishes a broad-based National Disaster Risk Council chaired by the Prime Minister and including the leader of the opposition and numerous sector leaders to provide broad guidance and promote unity of purpose in confronting national disasters. Regrettably, this National Disaster Risk Management Council has not met even once since I became the leader of the opposition last year, November. In my budget presentation in March, and on each occasion that I have spoken publicly since the pandemic, I have underscored the need for an all hands on deck national response to the COVID crisis. This is a time for cooperation among all Jamaicans, for coming together to help get our country out of this disaster in the true Jamaican spirit. The PNP again affirms our willingness to play an active role in the national effort to tackle the disaster. And we are renewing today our offer to cooperate with the government in whatever ways our assistance may be sought. Indeed, just over a week ago, we made several constructive proposals in a press release to reverse the current downward spiral. We were recommending immediate expansion of the reach of the vaccination program by bringing it to community centers, churches, and schools within densely populated urban communities and deep rural areas where many people are unable or unwilling to travel elsewhere to get the vaccine. We recommended enabling private medical practitioners across Jamaica to provide vaccinations to their patients, as this will provide an effective additional channel for the vaccine distribution system. We strongly recommend proactively enlisting major social influencers in the society, such as leading churchmen, sports personalities, and entertainers, for strident messages to persuade hesitant Jamaicans to get vaccinated. And we suggested publicizing the testimonials of doctors in the hospitals on the front lines as to the overwhelming prevalence of unvaccinated patients amongst those who are dying or falling seriously ill in our hospitals, as that will provide stark and compelling encouragement for vaccination in our country. I am glad to see a few signs that these suggestions have been considered, and some of them indeed apparently are being adopted. It was good to see Minister Tufton and Dr. Guy, our health spokesperson, together in a video just yesterday with a common message. And again, it was good to hear some of our leading church personalities and leaders from in the church coming out publicly to endorse vaccination. It is clear, my fellow Jamaicans, that a comprehensive national vaccination process, along with personal discipline in adhering to the social distancing guidelines that we've been living with for a year and a half, are the only way that Jamaica will get out of this crisis. Now that Jamaica finally has a good supply of the vaccine, I am calling on all influences in our society to shift gear and send the message to our people that we must all take it. The risks of hospitalization and death are much, much greater for those who get COVID without the protection of the vaccine. And with the very contagious Delta variant here, all of us must assume that there is a good chance that we will get it sooner or later. So please protect yourselves, protect your families, protect your friends and loved ones and colleagues. Vaccine hesitancy is perhaps the single greatest risk to Jamaica at this time. We must listen to the science from reputable, trustworthy sources and get on board. Ladies and gentlemen, the economy has been hammered by this pandemic. It contracted in 2020 by approximately 12% and is forecast for this year only to recover approximately half of those losses. People have lost their jobs, businesses have folded or contracted, personal savings for those who had any are depleted or completely used up. The Jamaican dollar has been falling by over 8% this year since January 1. Prices have been rising, and the monthly inflation in July, 1.5%, was the highest rate of inflation in the last 7 years of any month. Basic food prices, fuel and electricity prices, and basic hardware prices have risen alarmingly this year. And we have some charts that show some of these price movements. Though the data are lagging, there is no doubt that poverty has been rising. People are hungry, people are suffering. We have been calling repeatedly for the government to do much more to help those who are struggling to survive. Most of the relief under the CARE program ended last year, a year ago, but COVID still a keep, and people desperately need help. The government so far has failed to respond to those calls. They ran a massive budget surplus, I believe over $9 billion for the April to June quarter just finished. And we are calling on the government to use that surplus to protect the people of this country who need help. We are calling once again for a comprehensive program of relief for the hungry, the poor, and the vulnerable across Jamaica who are looking to the government for help in this period of deep strife. A recent study by Capri showed that the CARE program failed to reach many people who needed help and still need help. The flaws in the CARE program must be addressed. This time, the government must design it so that the distribution system of benefits reaches the full targeted population who who need assistance, taking into account the high levels of informality in the Jamaican economy. Transportation costs have increased and fares have just been raised. This is one more burden on the people at a time when many are already desperate. There is a tax on fuel that was used to pay for oil price insurance to protect us from spikes in the international price of oil, but is not being used for that purpose. We have been calling, and we call again now, on the government to remove that tax to ease the plight of motorists and users of public transport. When the easing up of the restrictions for COVID was announced at the beginning of July, I said in Parliament that with the Delta variant spreading rapidly across the world, Jamaica was skating on thin ice by relaxing our social distancing rules and related protocols. What was indeed entirely predictable has come to pass, and a period of restrictions and further sacrifices has become inevitable. The Prime Minister announced more intense measures last night in response to the escalation in cases, hospitalizations, and deaths since the rules were eased up in the beginning of July. We are to endure 7 no movement days over the coming 2 weeks. While many people will have lots of things to say about the specific measures announced by the Prime Minister, our primary objection is the lack of any support measures for the vulnerable sections of the population who will be most impacted by these no movement days. The Prime Minister must put in place a mechanism to allow assistance to flow to the families who will be most badly impacted by the 7 days of lockdown. 4 of those 7 no movement days are Mondays and Tuesdays, which are normal working days. Many Jamaicans hustle day to day to find food. Something must be done for them. Hourly paid workers, construction workers, persons who do job work, vendors on the streets and in the markets, they will lose their income on those days. They live hand to mouth. What is to happen to them? Implementing an intense period of lockdown over the coming 2 weeks with no provision for the vulnerable who will be exposed to hunger and more desperation is thoughtless, uncaring, and frankly, reckless. A properly considered response to the crisis would have taken these critical needs into account and made provision for them. The Prime Minister and his government have failed to do so. Were the framework of the National Disaster Risk Management Act being properly used, that council of which I spoke would have ensured that a broad range of voices were at the table to make wiser decisions in response to the current crisis. Just this week, we saw the effect of the emasculation of ODPEM, an institution under the Disaster Risk Management Act, when Tropical Storm Grace battered Jamaica without any proper warnings or preparation for our people to cope. The approach of the government needs to become far more inclusive if Jamaica is to get out of the very deep crisis we are now enduring. Once again, the opposition is willing, ready, and able to play our part if we are invited to the table. Thank you. I will now ask our spokesperson for finance, MP Julian Robinson, to develop some of the thoughts that have already been expressed in my presentation. Thank you.
Thank you, Comrade Leader. Good morning to members of the media and those who are joining online and listening in. From March of this year, in our budget presentations, we indicated to the government that what was on the table was insufficient to deal with the scale of need in the society and to take care of the most vulnerable who would have gone now 18 months without income or reduced income. At that time, we called for more to be done for that sector.
Since then, things have gotten worse for many persons. While there has been some recovery in the economy, mainly as a result of the opening up of the tourism market, many persons who operate in the informal sector continue to struggle. So we are seeing persons now in August who would be at 18 months without any income. In my budget presentation, I looked at the movement in the prices of goods and services, primarily basic food items that the majority of Jamaican people have to consume. Since March, those prices have gone up even more. And in a scenario where persons either have no income or reduced income, the pressure and the burden on the most vulnerable is at its most extreme. We're not just seeing increases in food prices, we're seeing increases in gas prices. In fact, gas prices are at the highest level ever. Food prices are at the highest level ever, and hardware and construction prices are at the highest level ever. For the quarter which ended June 2021, the government projected to have a deficit of $9 billion. It has ended up with a surplus of $9 billion. It has earned more revenues, primarily through the collection of taxes on imports than it projected. And it has spent $7.5 billion less in expenditure than it projected. But I do have some questions for the Minister of Finance. In the expenditures, have we ensured that all the outstanding arrears, for example, to the providers of services in our healthcare sector, like janitorial security services, have all those providers been paid? Because when we commenced the budget debate, there was a deficit of $6 billion owed to those persons. Have those arrears been cleared? We also know, for example, in the National Works Agency, that many of the contractors who provide services to repair roads are owed millions of dollars. Have those persons been paid? While it is important that we have a budget surplus, we need to know that the government is paying its bills. And because the government has benefited, quite frankly, from the uptick in economic activity with the additional taxes on imports, it is vitally important that that budget surplus be used to provide for the most vulnerable in our society. We are now about to commence on the first weekend of the lockdowns, and nothing has been put in place to deal with the most vulnerable. It is Friday, and it is not too late. There are measures that the government can take at this late stage. For example, by making provisions available to members of parliament and councillors, so that even now we can go to suppliers to get food packages for the most vulnerable in our society. That can be done. If the cash can be provided today, a commitment letter can be done from the Ministry of Finance to the Constituency Development Fund so that we can take those commitment letters to suppliers. Because there are persons who will not be able to survive the 3 days, Sunday, Monday, and Tuesday, without support. So I'm specifically calling on the government to do something today so that we can make provisions for persons this weekend. And similarly, while there will be more notice for next weekend, to equally make a provision available for next weekend so that, again, those persons who would have lost income over the 3 days of the lockdown or who just have been struggling from the beginning of COVID will be able to have food to eat on the table. I'm very saddened that after the many calls that we have made beginning in March, very little to nothing has been done to deal with the most vulnerable in our society. The government now has the means because they have the surplus to do so. And it is a responsibility of a government to ensure that those who are most vulnerable are taken care of. We're moving into back to school, and even if school is going to be online for most, parents are now burdened with the expenses of not just books, but importantly, ensuring that students have an electronic device, either a tablet or a computer. And while the government has made some provision through e-learning and other initiatives, it is woefully inadequate to deal with the majority of students who have not been able to get access to these devices. I want to call again for the removal of the GCT on those electronic devices so that persons who are most in need can afford to get these devices. And finally, before I sit, I just want to show you the movement in some of the prices. On your screen, we took some examples of cement price, of hardware prices, and I'll just go for. The first one, we looked at food prices, basic items, rice, sugar, flour, oil, chicken back, and corned beef. And this is just over a 1 year period from last year to this year. And we are seeing price increases from a low of 14% up to 50% for cooking oil in one instance. And this is July data. The prices continue to rise even now in August. And just today, I heard where the president of JMEA is projecting that prices will continue to rise because of supply chain issues related to supplies out of China. I also want to show you basic hardware and construction items, right? Persons who want to fix up their house. If you look at the price of steel, if you look at the price of ply, as an example, ply moved last year from 2,700 to 6,000. And I know if you go to specific hardwares, these prices are higher than that. So we're seeing a range. Cement has been relatively stable, but we're seeing increases that range from a low of 6% for cement up to 122% for ply.
The other 5 items are all over 40%.
And all the other items are over 40%. Now, I'm saying this within a context where people have lost their income, where we are going into lockdowns. There's diminished opportunity for them to earn. People like a barber, I went to my barber today, 3 days of no income. What happens to a barber, a hairdresser? We have to reach out to those persons. Many of them, they pay licenses to their municipal corporations. We need to provide some relief for them because they have no alternative. So in summary, I just want to reiterate what the opposition leader has said. We need relief now. This weekend, the government can provide through the Ministry of Finance to the Constituency Development Fund a commitment so that MPs, and in the case of councillors, they can do something with suppliers to get food packages out so that persons are not starving over this weekend. I also believe the government has to make some consideration about small corner shops in communities. The majority of Jamaicans cannot afford to go to a supermarket to buy up for 3 days. They're not on a fridge to do that. They don't have the resources to do that. They're still going to have to buy what the money can do for today. And then come Sunday, if they have another money, they have to go back and buy it again. Some provision has to be made for those small corner shops in communities to remain open for a limited period to allow people to be able to eat. Thank you.
Thank you very much, MP Robinson. And the next person that you will hear from is Dr. Morris Guy. He's joining us virtually, and so now we turn our attention to the Zoom platform. Dr. Guy.
Thank you very much, Dr. Campbell. Good morning, members of the media. Good morning, Jamaica. The health sector in this country is in dire straits. We've seen where upwards of 900 persons have been admitted to the hospital being treated for COVID-19. We've seen where images have come out in the national landscape where people have been sitting on chairs, getting oxygen, sitting on the tents, even when grace was passing through this country. We have noticed where the head of the Western Regional Health Authority has said that inadequate PPEs are there for the nursing and the medical staff, hence the reason for some of our frontline health workers coming down with COVID-19. The spokesman on finance made mention of the fact that there are many suppliers to hospitals who have not been paid. Suppliers including food suppliers who have been owed money for months. And we have seen where there are reports coming out of some hospitals of shortage of oxygen. We cannot go back to a situation we had during the second phase when many people suffered as a consequence of these inadequacies. Yet, we are assured by the Ministry of Health and Wellness that adequate provisions had been made for PPEs, for oxygen, for the number of doctors, and to get additional staff to help in the hospital sector. Our country, our people are and will continue to suffer because we are only seeing the early rise of the third phase. We are going to be seeing a lot more. And as we have been told 2 days ago, that Delta was discovered in samples. And interestingly, ladies and gentlemen, samples that were taken from the first week of July, which means that if you follow the science, an incubation period of 14 days, it means that Delta was here from in June of this year. Now, we are seeing that as a consequence of Delta being here, a consequence of the government in its action in opening the economy, as a consequence of the government giving its imprimatur to these huge super spreaders that the country is now suffering. The solution that the PNP is suggesting now are manifold. The leader of the opposition made mention of vaccination, which we are all on board about. All of our members of parliament, that is from the lower house and those who sit in the Senate, have been vaccinated. We have and we continue to implore our constituents to be vaccinated. We have been assured, as the leader of the opposition said, that there is sufficient vaccine, as told to us by the government, to start the process of trying to get all persons vaccinated. There's this notion going around that the PNP has never supported the government in terms of the vaccination program. And I want to put that lie to rest, because this party has been at the forefront. We have never been invited, except for a couple of days ago when I was invited. But as a party, we have never been invited to be part of this. But we have always been there, assisting, helping, because at the end of the day, it is Jamaica we are fighting for as a political party. The health of Jamaica we are fighting for. Secondly, one of the things we need to do as well, and I'm sure our spokesman on transportation will speak to the gatherings that take place in the transportation sector. We need also to ensure that our persons who are tested, that they get the results on a timely basis. We cannot have tests being outstanding for 10 and 14 days, particularly in a time when we have this virulent strain of the Delta virus going around. This is the example that we have been seeing as indicated to us by many persons, and I know of it personally occurring. The matter as it relates to the Pfizer vaccine, which is to be administered to our children, we are supportive of it. But we are asking the Ministry of Health to ensure that the cold chain is not broken. Because if you do that, you run the risk at the end of the day of giving our children vaccine which has not been properly stored. So we are appealing to the Ministry of Health and Wellness to ensure that that cold chain is maintained from the refrigeration to the arms of our children to ensure that they are properly protected. Now, the question that needs to be asked, and whilst we appreciate the fact that the government has decided to do a lockdown and how it is done, and as the leader said, it is skating on thin ice to do how it is being done. 2 weeks of lockdown will only arrest the spread of the COVID-19. It may very well be that the government after this 2 week will decide another 2 weeks of lockdown as well, because it will need sufficient time for the virus to start spreading, to stop spreading. We have seen where the positivity rates have been high, and we have seen where the reproductive rate is at 1.4, which is significantly high. We need to get it below 1. So at this point in time, Ladies and gentlemen, the country is in for a rough ride as it relates to COVID-19, and the numbers are going to get higher and higher. And unfortunately, as we have seen, the deaths have been increasing. Thank you.
Thank you very much. Thank you very much, Dr. Guy. Let me say, I see Senator Bunting is now online when we get to the questioning, just in case there's a question for him. I'll now invite MP Paulwell to come and make his presentation.
Colleagues, members of the media, I shall be brief because in relation to petroleum prices, we have been monitoring these on a weekly basis as the prices are published by Petroleum. We are seeing the highest price of petroleum products in the history of our country. Just monitoring between July and August, we have seen upwards of 40% in some of the products. And the fact of the matter is that these prices that are published by Petroleum are not the final prices. To these prices are added margins from the marketing companies and also margins from the retailers. You can go and see prices up over $200 per liter on a number of the products today. A most significant, and I'll just focus a little bit on gasoline 87. We've seen a price movement of 41% since July to the July last year to August 19 of this year. And then we have, and these again are the Petroleum prices to which you have to take into account the marketing companies' margins and the retailers' margins. Gasoline 90, we have seen a price movement of 43%. And of course, the poor people fuel, kerosene, we have seen a 41% increase in those prices from last year to now. I want to just focus briefly on the issue of taxation and why I believe that some aspects of it are unconscionable. There are three items that comprise taxation for petroleum products. You have the hedge, you have, and from the hedge, we realize about $6 or $7 billion in revenues. Is a special consumption tax, and there is an ad valorem special consumption tax. I should point out that since 2016, the government has used this tax to offset the losses that they suffered due to that 1.5% incentive that they had proclaimed. In relation to the hedge, this has been a most unconscionable aspect of the taxation because the hedge was established for a special purpose. For example, if last year the government had used the hedge money to purchase fuel when the price per barrel was below $20, then it would have been a proper use of the hedge. It's an insurance, so you'd make those pre-purchases. So today, we as consumers would benefit because the price of fuel is now at over $70 per barrel. So we have missed an opportunity, and the Minister of Finance must accept responsibility for that. But beyond that, to maintain the hedge at this time is most unfair and unconscionable. And we are asking that that tax, as it is not being used for the purpose, be returned to the consumers, and for there to be a rational review of all the taxes that are applicable. Because in that liter of fuel that we purchase, more than half of it represents taxation. Thank you very much.
Thank you very much, MP Paulwell, for being very candid and to the point. I think everyone can understand the points that you have made succinctly. We'll now hear from MP and the shadow spokesperson for transportation, Mickey Affirms.
Morning, everyone. As been expressed before, and we had released quite a few press statements showing our concern, expressing our concern on the transport sector. The transport sector is one of those that the Ministry of Health has expressed and stated is a super spreader in the fight towards COVID. We have been concerned with the tightening of the hours that our transport centers and our transport sector have not been given the attention that it should have been. With the implementation of new fares, we have seen that the sector itself, there has been some confusion within the sector. And we ask the question, where is the Minister of Transport? Which rock is he hiding under? It is due time that the Minister of Transport comes to the people, not only the sector, but to the transport sector and the Jamaican people, to show some leadership in a sector that is showing some chaos at this point in time. As my colleagues have expressed, we have stated time and time again that this is not ordinary times, and that we think that the government should step in to reduce not only the cost to the consumer, the traveling public, but also to those who have invested in the transport sector. The fare increase that has been given to the transport sector, it is obvious that there was no thought to it. We have stated before that we think that the minimum wage, which that report should have been sent to the government from last year, January, and which has not been implemented, should be done hand in hand with an increase so that poor people can at least afford the increase in the bus fares that have been implemented by the government. But also, the minister on the Thursday implemented or notified the country that there was going to be a fare increase. On the Sunday is when the Transport Authority sent out a schedule of what the fare increases ought to be, but with no public education taking place, which created some chaos in the system. Again, we're asking the Prime Minister that if this minister is not up to the task, because as it is now, if you go out into Halfway Tree or into Mandeville Town, you will see the chaos that is taking place at the transport centers or even in the taxis or the buses that these citizens have to travel in. But also is that we want to say to the government that you have a responsibility, especially in the Kingston metropolitan region, where the JUTC is concerned. You have been coming out hard and fast against the transport operators, the route taxes, the Hackney carriage, but yet still the JUTC is in breach of its own license. If the Jamaica Urban Transit Company, which is a government-owned entity, was able to provide the adequate seating that it is licensed to, we would not have this chaos in the KMTR in the transport system. So again, we say to the Prime Minister, if this minister is not up to the task, find another one. If not, you need to sit with the transport sector and deal with the matters that are causing the chaos in the system at this point in time. I thank you.
Thank you very much, MP Phillips. Ladies and gentlemen, at this point in time, we're going to take questions from the media. Just before, I want to read a quote, and it says, "The difference between listening and pretending to listen is enormous. Real listening is a willingness to let the other person change you. When I'm willing to let them change me, something happens between us that's more interesting than a pair of dwelling monologues." And that's from Alan Alda. When we have a determined position that is defiant, not even the Holy Spirit will be able to change us. And I'm saying that because the opposition has been very consistent in making its points. And I want for the government to start listening and not only pretend to listen. The leader has spoken and the other spokespersons have, and they are now willing to take the questions. I'm told that CVM we'll start. Ms. Williams?
Thank you. Thank you very much. Are you hearing me? Yes?
Yes.
All right. So just to be clear, the main objection that is to the government's 7 days of lockdown is that no comprehensive program of relief has been sorted out for the people. That's the main objection.
Yeah, that is a principal objection. Clearly, we regret that the situation has reached the point where we're having to be going to 7 days of no movement. And, you know, that is as a result of the decision that the government took at the beginning of July. It is what it is. A response is necessary. One could approach that response in a variety of ways. The government has made a decision as to how it thinks the response should go. Our main concern is that response completely ignores the realities on the ground and how people will be impacted by that. And we've outlined the many ways in which that would be very, very painful and difficult for many, many people. We've also suggested some modifications, for example, allowing access to corner shops in communities during the no movement days for specific periods of time, since many people have to shop on a daily basis because they do not have the income to stock up in advance. These are the sort of things we need to see some flexibility around, but our primary problem with it is that it is just going to expose the vulnerable people of the country to more sufferation.
And thank you, Leader. And the Ministry of Health, when they do a lockdown, they are to also go into these hot areas and do proper testing and contact tracing. It's not just to lock down the community and not do anything, right? Who is next? Okay, if there are no questions, that means that everything was properly understood. And let me thank you very much, ladies and gentlemen of the media. Thank you very much, leader and spokespersons. Have a good day. Please be safe. If you have not done so already, we encourage you to go out and get vaccinated and to adhere to the rules and the protocols from the Ministry of Health. God bless you and have a good afternoon.
Thanks, gentlemen. Yeah. Should we take a photo?